Yes, my name is Professor Wellington Oyibo. I'm a consultant medical parasitologist at the Center for Transdisciplinary Research in Malaria and Neglected Tropical Diseases, which is the host of the Andy Center of Excellence for Malaria Diagnosis at the University of Lagos. So basically, we are here and to speak around the mandatory parasitological confirmation of suspected malaria cases before treatment with ACTs. And what we have seen consistently in facility reports is the high test positivity rates. And this underpins the fact that either cases are still being diagnosed clinically or the test results have not been properly reported. Part of the key thing I want to talk about too is the utility of the rapid malaria diagnostic tests. Of course, vis-a-vis malaria microscopy. Of course, we know the standards for routine diagnosis of malaria is on the RDTs or microscopy. But quite a number of healthcare providers and people do not believe on the results of the rapid diagnostic tests. Rather, they seek and have more confidence in the report of malaria microscopy. But we have to look at the balance. What are these tests? First of all, the rapid diagnostic test is an immunochromatographic device that detects the antigens of malaria parasites. The microscopy will require you to do the blood spin, and then you have to stain, and then you have to read the slides, and the capacity to read the slide correctly depends on the competency of the microscopists. But again, those with those capacities is not much. But the rapid diagnostic test is easy to do, rapid. Within 20 minutes, 30 minutes, you have the results. And then you can rule out or rule in malaria, as it were. I'm saying here with this conversation that the RDT is high performing and is very comparative to the best microscopy. I'm talking about the RDTs, pre-qualified, and those that are commonly used, good brands. They are as good as the microscopies. Nigeria will not continue to be described as a high-burden country based on the results that we feel, other clinical results of false positive results that we churn out. So why should we not have confidence in the rapid diagnostic test? Rapid diagnostic test is one of the technologies that we have. It's just like having a cell phone, which you can put in your pocket to call, or you have a pen phone, or you have a wristwatch that can record. That's technology. And because the RDTs have been properly evaluated and they've gone through different layers of testing, product testing, lot testing, and all the evaluations done, we have this confidence. And again, I speak because our center is the WHO's Malaria Rapid Diagnostic Test Lot Verification Center, where we look at RDTs when they arrive in the country and then different storage conditions and store at the certain temperatures and monitor, and we show they still keep that utility and they're still high performing. So why not use RDTs? Why not rule out malaria and then in the course of the patient's assessments, we look for other cause of fever? Malaria is not likely in many parts of Nigeria, especially the southern part of Nigeria, to be one of the critical causes of fever. Yes, malaria can kill. You need to, to be, careful with the interpretation of your text, but malaria is not. We know in that fever spectrum what we have. Malaria could just be the third or fourth. And when you treat presumptively, there's a danger because pneumonia will present the same in children. Upper respiratory, lower respiratory infection will present the same. And how do you now believe that if you give an ACT, the patient who does not have malaria will do well? And that's the negative thing there. So you just delay the evil day and make things worse for the patients. So when you do a test using the RDTs, follow the procedures. First of all, let the patient know that you're doing this test to guide the treatment. In case the patient says, oh, I know I have malaria, I know how I feel. That's what you're going to have in many situations when you have an infectious disease in your system. So it doesn't work that way at all. The RDTs, which are now being spread around across both communicable and non-communicable diseases, have great utility. And the evidence are clear to every healthcare provider. Don't bring your personal decision to it. There are large reports in the data that shows the RDTs are performing and they can basically be helpful in effective malaria case management. Look at the results, perform the test properly, read the instruction for use, and properly do the test, wait at the right time, read your results. If it's negative, please look for other source, other cause of fever. And that's what we recommend. And that is Nigeria's best practice as it is for all children and for those that present in the facility even with severe disease. While they are being prepared or assessed, the RDT's result would have been out. You can rule out malaria quickly, and then you know what to do. Let's not continue to treat patients for malaria when the disease is not there. The question is, what disease are you treating? And again, at the end, you will now query resistant malaria. How can you query resistant malaria when you give ACTs when the patient does not have parasites and yet don't have the symptoms of malaria? That's the purpose. Let's do it. Let's put malaria where it is. It's a distraction now. And when we continue to say malaria has the highest burden, it cannot remain to be so. And let us know that we are close to over 130 countries with malaria in the last years, but right now there are just 93 countries. So countries are going to elimination. We want to work together, everyone, healthcare providers and the general population, to take malaria where it belongs, and we'll be free to attend to other things that we need. And malaria cannot continue to be the scapegoat. I'm sure this video helps. And if you have any queries, please, you just do a search on the Andy Center of Excellence for Malaria Diagnosis at the College of Medicine. You can have our contacts. Thank you as you practice very well. God bless you.